and state averages that hover around 8%, with Floyd County at 6.7% and Clark County at 7.1%. And I think we can expect that number to continue dropping as the Ohio River Bridges project gets underway and as more globally successful companies such as Amazon choose southern Indiana. If you folks haven't seen River Ridge Commerce Center in the last 6 months to a year, it's a jewel. It is truly a jewel that we have right here in the Midwest to have 3,000 plus acres prime, ready for development. And it's just going to get better. Indiana is one of only 9 states to have a AAA bond rating. That's impressive. Only one of 9 states out of 50 that has a AAA bond rating. Since July 2009, 59,500 new manufacturing jobs have been added in Indiana. Of course, like every state, Indiana faces uncertainty that is holding us back from the progress we'd all hope to see. One of the most pressing sources of uncertainty is the financing of our healthcare system. This is what I would like to discuss with you briefly this evening. Some of this is kind of dry because we have to use a lot of numbers to make comparisons, but it's an issue that is a significant part of our state budget. Our state budget from the general fund is $14 billion, and we spend $3 billion on health care in Indiana. When you add what the federal government spends, it's over $9 billion a year. So $3 billion out of $14 billion, or approximately 20% of our state budget goes to health care in the state of Indiana, and that is about on par with other Midwestern states. The United States Supreme Court's decision to uphold most of President Obama's health care reform package, known as the Affordable Care Act, put a series of options on the table for the states like Indiana, because we can opt in or out of different parts of the law. As we head into the 2013 session of the General Assembly, which begins this January, state leaders in the executive and legislative branches will have tough decisions to make as we determine what health care in Indiana will look like in the future. The population of the state of Indiana is about 6.3 million people. About 14% of those 6.3 million have no insurance. Most states average about 13%, and we're right at 14%. The most prominent and most costly feature of the Affordable Care Act is the expansion of Medicaid. The expansion of Medicaid. We'll be going from providing Medicaid to 100% of those at the federal poverty level, at that 100% of that level, which is about $23,400 for a family of 4. We will increase that to 133% of the federal poverty level, which means that a family of 4 with about a $30,000 income will be eligible for Medicaid, part of that Medicaid expansion expense. The debate is how to fund it. I don't believe the debate is going to be so much as whether it's going to be provided, but how we provide it and how we fund it is going to be the major task facing Indiana. Implementing this expansion would cost an estimated $1.4 to $1.9 billion, just the expansion, and put an estimated 1 in 4 Hoosiers in the Medicaid system. 1 out of 4 Hoosiers would be eligible to participate in the state Medicaid program for health care. At the same time, 300,000 to 525,000 Hoosiers are expected to remain without health care coverage even if we expand Medicaid. So we're looking at 500,000 people, even with the Medicaid expansion, under the federal program would still be without health care coverage. To fund this expansion, Indiana will have to either raise taxes on all Hoosiers, potentially damaging our economy, or cut state spending in areas like schools, roads, and public safety. Of course, Indiana could opt out of the Medicaid expansion and maintain the status quo. The Supreme Court ruling said we can opt out. We don't have to participate in the expansion. If we do participate in the expansion, we'll have to do this under the guidelines established by the federal government. Of course, Indiana could opt out of Medicaid expansion, maintain the status quo, but this carries potential negative consequences also. Because the Affordable Care Act forces Americans to buy health insurance or pay a tax penalty, it's possible that many low-income Hoosiers would have to pay the fine if we don't expand Medicaid. So if we don't expand Medicaid and our lower-income folks are fined for not having insurance, it's going to be a tremendous burden on them under this Federal Health Care Act to have to pay that fine for not having insurance when in fact the state of Indiana could have done that. Complicated rules in the law exempt very low-income people from the tax penalty, but it's impossible to say at this point who would have to pay and who wouldn't. The summary of the Affordable Care Act, the summary that I have is 14 pages. It's that bill that one of the congressmen, one of the persons in Washington said we have to pass this so we can read it, or whatever it was that the quote was. It's just the summary alone is 14 pages. It is so complicated. There are 37, and I'm just not speaking either way because the bill's, there's 37 new programs in that Affordable Care Act. New programs that will be established by the federal government. And over 17 new taxes are included in that Affordable Care Act. Even the amount of the fine is a complicated formula for those who will be fined for that don't have insurance. The fine is phased in starting in 2014, and it doesn't reach its full level until 2016. The base amount is $695 per person per year, but middle-income families without insurance could pay more, and the cost of insurance in Indiana could also affect the amount. Rather than leaving Hoosiers liable for the Affordable Care Act's tax penalty or spending billions to expand Medicaid, Indiana leaders want to take a different approach that's based on a program with a proven track record for our state, and it's called the Healthy Indiana Plan. Instead of expanding regular Medicaid to 133% of poverty, we want to expand the Healthy Indiana Plan to the same people. Rather than expand the Medicaid program at the federal government, Indiana is looking very strongly at expanding its own Healthy Indiana Plan. The problem is, guess what? We have to get approval from the federal government to do that. And that's where a lot of the complications just get worse. You might have heard of Healthy Indiana Plan before, or HIP. I'll give you a brief explanation of those who haven't heard of it. It's a great plan. Healthy Indiana Plan is a state program created in 2008 and is designed to provide health care coverage to low-income Hoosiers, but in a more consumer-driven way than Medicaid. Everyone in Healthy Indiana Plan gets commercial health insurance, and the state pays most of the premiums. But unlike Medicaid, participants have to pay a small part of the cost, approximately up to 5% of their family income. That means people in the Healthy Indiana Plan only use health care when they actually need it. Additionally, it's a requirement to be in the Healthy Indiana Plan that you get preventive checkups, like physicals, because if health problems are caught early, as we know, it costs less to treat them down the road. These required checkups are 100% paid by the state, but other types of health care require patients to contribute some of their own finances. The Indiana legislature chose to implement the Healthy Indiana Plan because it encourages participants to practice healthy behaviors such as preventative care and limit unnecessary health care usage by giving participants a little skin in the game, if you will. Instead of giving them a handout or an entitlement such as Medicaid, which basically doesn't cost any participant any amount of money, although there occasionally are some minimal amounts of copays. Indiana currently has permission from the federal government to use some federal funding to help pay for the Healthy Indiana Plan, but that permission expires at the end of 2013. Federal officials have said that they may not extend Indiana's permission to operate the Healthy Indiana Plan, in part with federal money, because the Healthy Indiana Plan requires enrollees to pay a small share of their medical bills, while Medicaid is completely free. In other words, if you're going to have these recipients pay any part of their health care costs, we're not going to approve that. That's what the federal government doesn't like about the Healthy Indiana Plan. I'm hopeful that the federal government realizes that the Healthy Indiana Plan has worked for Indiana and changed its mind, but the lack of clarity on this issue makes it hard for us to plan for the future. As you can see, the decision on whether or not to expand Medicaid is multifaceted, complicated, and involves serious trade-offs. It also hinges on whether Healthy Indiana Plan is allowed to continue. Aside from Medicaid, Indiana has another decision to make as a result of the Affordable Care Act. This law also requires each state to have a health insurance exchange, which will be online, one-stop shop to compare and buy health insurance plans. If you don't have a health insurance plan, you'll be able to go to the health exchange, go online, find a plan that suits you, and do your own shopping for health insurance. The state can set up the rules for the insurance companies to offer their plans on this exchange, or the state can let the federal government run our exchange for us. That's a decision we have to make. Do we run our own health exchange, this one-stop shop to buy insurance? Do we partner with the federal government and have a hybrid, or do we let the federal government run the entire health exchange program? The state can set up its own rules for insurance companies to offer their plans on this exchange, or the state can let the federal government run the exchange for us, as I mentioned. If we decide to run our own insurance exchange, it will make sure our leaders who are in Indiana have a say in what type of insurance Hoosiers can buy. So we get to pretty much dictate what we will provide for our Hoosiers, what will be available, a lot of the price. But if we turn it over to the federal government, it will be left up to them to make all the calls on what type of insurance is being available. If we decide to run our own insurance exchange, it will make leaders here in Indiana have a say in what Hoosiers can buy, how much it would run, what the different benefit packages are, etc. Either way, running the exchange will cost Indiana $50 to $60 million in the first several years. On the other hand, we could avoid these costs by letting the federal government run Indiana's exchange, but that would mean Washington would get to decide what kind of health insurance Hoosiers can buy. There are trade-offs no matter what Indiana chooses to do, and I'm not sure either option will really be good for Hoosiers. I think the gubernatorial candidates have maybe switched off on this. I know the Republican candidate has basically said he will not support any health exchange unless it's run by the state of Indiana. The Democrat candidate has basically said they would support a hybrid, and I believe the Libertarian candidate has taken the position of a hybrid, some type of mixture. I've told you about the cost to the state to pay for the Affordable Care Act, but that's far from the end of the story. The law also implements several new federal taxes, as I mentioned earlier. I believe there's 17 in all, to cover its spending, all of which will have a financial impact on healthcare consumers. Health insurance companies will have to pay a tax on their policies. So Charlie, if you've got a $300 a month health insurance premium, whoever sold you that's going to pay a tax on that policy. That tax will cost the insurance industry $8 billion in 2014 and grow even higher after that. Prescription drug manufacturers will have to pay an annual tax based on their sales. That tax is expected to cost the drug industry $85 billion per year over the first 10 years. You know who's going to pay that? We are. Makers of medical devices, devices for prosthesis for a knee replacement, will be subject to a 2.3 sales tax on almost all transactions by medical devices. Those stents that they put in us to help us with our circulation, sales tax, 2.3%. That tax is expected to cost the medical device industry $29 billion over 10 years. And similar to the Affordable Care Act tax on people for not having health insurance, the law taxes employers that don't offer insurance to their employees, as long as the company hires at least 50 employees. Like the individual fine for not having insurance, the employer fine has a complicated formula. But the base amount is about $2,000 for every employee the business has, excluding the first 30 employees. Today I read an article in the Indianapolis Star that said that about 85% of the businesses in Kentucky or Indiana have 9 or fewer employees. In Kentucky, Illinois, Ohio, it's a little bit higher than that. But so most of our companies are, as you know, are very small. Very small mom and pops that keeps Indiana going strong. The problem with all these taxes is that employers aren't just getting a large pile of money that will let them pay new taxes or buy health insurance for their employees. In the case of the fine for not providing health insurance, almost all companies with more than 50 employees already offer insurance. But if such a company doesn't offer it now, the company will have to raise the price of its products or its consumers, you and me, or cut costs somewhere else to afford insurance on the federal fine. In fact, if I have a company with 51 employees that currently doesn't provide health insurance, guess what? I'm probably going to lay off 2 people to get below 50. President Obama's law gives me financial incentives to lay off 2 people, like I said, if I have 50 employees, so they won't be taxed for not offering insurance. The same goes for insurance companies, medical device makers, and drug manufacturers. For these companies to pay their new tax bills, we will all have to pay more for our medicine and our healthcare procedures, or these companies will have to cut other costs. That could mean laying off employees, closing facilities, but the end result for you and me as consumers will be a weaker healthcare industry that will make it harder to get life-saving medicines and first-class treatments for all kinds of diseases. I think we can all agree that healthcare costs across the country and in our state are far too high, and that insurance must be accessible. Finding a solution to these issues only becomes more urgent as more baby boomers retire and need access to increased medical care. Hopefully, the discussions and decisions that take place in the near future results of the Affordable Care Act will offer some answers and ultimately help ensure Hoosiers have access to affordable, high-quality health care in a way that works for Indiana. I encourage all Indiana residents to get involved in the dialogue surrounding health care in our state. It's going to be an important year, and all Hoosiers will be affected. It pretty much sums up a brief summary of the Affordable Care Act as it impacts our state. I believe we have until November the 16th, the governor has until November the 16th to send a letter to Health and Human Services telling them whether or not, in fact, Indiana will adopt a health exchange or, in fact, will go its own way, would participate with the federal governments. And I'm not sure that maybe that will be extended or ask for an extension on that. It will be a very few short days after the election, and I'm not sure the newly elected administration and the newly elected governor who there will be able to make that decision that quickly. So we may get an extension on that. We have to send in an intent of what we're going to do, not necessarily the hardcore plan, but at least some intent of what we're going to do. So a lot of decisions are going to be coming fast and furious between November 15th and the 1st of January. I have some experience with the pain clinic situation in Jeffersonville, which I'm offering some legislation on in the next session. I'll be glad to address that issue. We go into budget session in January for our 2-year budget that will be coming up. Indiana's budget from the general fund is $14 billion a year. Most of that income comes from sales tax, personal income tax, corporate income tax, and other taxes on services that we provide. It's a big year for budget next year. Be a new administration, be a lot of changes in legislation. Charlie Slade and I talked about some issues that probably